are going to talk about the cranial nerves. The cranial nerves. And there are 12 pair of cranial nerves. When you say there are 12 pair of cranial nerves, if you remember, cranial number 1 and 2 belong to forebrain. And what about the cranial number 3 to 12? They come from the brainstem. If you say they come from the brainstem, cranial number 3 to 12, what do you include in the brainstem? In the brainstem, we have three components, that is midbrain, followed by the pons, and followed by the medulla oblongata. This is the discussion we are going to do now. So, there are 12 pair of cranial nerves, yes, and the first two, 1 and 2, belong to forebrain. We already had discussed that during developmental discussion. And cranial number 3 to 12 come from the brainstem, which itself has three components, midbrain, followed by the pons, followed by the medulla oblongata. Let us look at the further details. See, this is the inferior view of the brain, the base of the brain, and we will magnify this area because we want to know the various cranial nerves here. You will find cranial number 1, olfactory nerve. This is the olfactory nerve here. And cranial number 2, that is the optic nerve. There will be optic nerve here. And cranial number 3, which is oculomotor nerve, we will magnify and see. Then let us magnify and see. As you're magnifying this area, let us look at some of the details of cranial nerves again. See, this is, I'll mark it now, cranial number 1 pathway. You mean to say the olfactory nerve? Yes, nerve of telencephalon. So this is the cranial nerve number 1, the olfactory nerve pathway. Yes, the nerve of telencephalon. What about the optic nerve? Optic nerve is the nerve of diencephalon. Optic nerve is the nerve of diencephalon. So I'll magnify still further. This is the optic nerve. If this is the optic nerve, then what is the nerve here? This is actually the oculomotor nerve. This is the oculomotor nerve. This is oculomotor. And the thinnest cranial nerve is here, trochlear nerve. Trochlear nerve. This is 4. So you're telling that this is the oculomotor nerve, third nerve, and there'll be some trochlear nerve. Yes. But I can't see anything here. Yeah, because this diagram is not so clear. That's why. Just orientation you can have. Then what is after that? After that, you see the thickest cranial nerve. And who's the thickest cranial nerve? That is the trigeminal coming from pons. This is pons. This is trigeminal. And what about the sixth nerve? This is now the sixth nerve, which is abducens nerve. And if this is 6, then this must be 7. Yes, facial nerve. And this must be 8. Yes, that is the vestibulocochlear nerve. So as you can see that this will be the 6th nerve, which is near the midline. Then there's a 7th nerve, which is more lateral. There's a 8th nerve, which is still more lateral. They're all at the pontomedullary junction because this is pons and this is medulla. That is pons and this is medulla. So this is pontomedullary junction. You can mark it here. This is the pontomedullary junction. So where the 5th nerve came from? 5th nerve actually came from the pons. And where the nerve number 3, 4 came from? They came from the midbrain. So nerve number 3, 4 come from midbrain. Yes. And nerve number 5 come from the pons. Yes. And nerve number 5, 6, 7, 8 come from pontomedullary junction. Then where is the number 9, 10, 11, 12? The number 9, 10, 11, 12, they come from the medulla oblongata. You will see this is the number 9, 10 and 11. So 9, 10 and 11 coming from medulla oblongata. Yes. Behind olive. In the medulla oblongata, you have olive. So behind the olive in medulla oblongata, you have number 9, 10, 11. What is in front of olive? In front of olive, you will have the nerve number 12. So nerve number 12 will be in front of the olive. See, this is the orientation only, but the things are not so clear here, so we'll use some other diagram now. So this is one diagram which we are going to draw also. See, you're talking about brainstem, which is having 3 components now, giving you cranial nerve number 3 to 12. That is the area we want to focus upon mostly. And this is the diagram which is more clear. So we'll magnify. First, you will tell me what are the various components of the brainstem. and there is a midbrain, crus cerebri. You can see this is crus cerebri. So this is the crus cerebri of midbrain here. Yes, crus cerebri of midbrain. And this is pons. Yeah, that is pons. And then you will tell that this is the medulla oblongata. Yeah, that is the medulla oblongata. So here you have the medulla oblongata, there you have the pons, this is the midbrain, crus cerebri. So this is all brainstem. Yes, brainstem give you nerve number 3 to 12. So this is nerve number 3 now. I'll show you. This is the nerve number 3. If you say that is the number 3, it is on both sides, you can see, coming from midbrain. And then this is the number 4, the thinnest cranial nerve. Why it is thinnest cranial nerve? Because it has very few axons. You see here. This is the number 3 and 4 coming from the midbrain. And the number 3 and 4 which come from the midbrain are trochlear nerve is the thinnest cranial nerve because it is having very few axons. The thickest cranial nerve will be trigeminal. This is trigeminal, thickest cranial nerve. Why it is trigeminal thickest? Because it is 3 nerves into 1. Because 3 nerves into 1, they have a lot of axons, so making it thickest cranial nerve. So you are telling that this is trigeminal on other side? Yes, coming from pons. So pons will give us trigeminal nerve. Yes. What about the number 5, 6, 7, 8 then? If you're talking about number 5, 6, 7, 8, let us still magnify the diagram and you will see this is nerve number 6. If you say this is nerve number 6, the abducens nerve near the midline, yes, it is the abducens nerve, the number 6 near the midline. At the pontomedullary junction. It is at the pontomedullary junction because we are telling this is pons and this is medulla oblongata. So this is pontomedullary junction where you can see 6th nerve near the midline. What is lateral to that? That is the 7th nerve. This is the 7th nerve, facial nerve. And what is still more lateral to that? That is the 8th nerve having 2 component. So if you say 8th nerve having 2 component mean vestibulocochlear nerve. Yes, vestibulocochlear nerve. So you are trying to say that this is the number 6. Yes. And this is the number 7. Yes, and this is the number 8 having 2 component here, 2 component. Yes, and what is this? This is number 9, 10, 11 behind olive. This is olive. So you're telling that this is olive and behind that you have the number 9, 10, 11. Then what is this? This is the number 12. The number 12. Understand that in the medulla oblongata you have one anterior structure which is called pyramid. There is one anterior structure which is called pyramid, and what is posterior structure? That is olive. This is olive. So you are telling that this is the pyramid here. Yes, that is the pyramid here, and this is the olive behind that. Yes, that is the olive behind that. What is between pyramid and olive is a question, and you tell what is between pyramid and olive is the 12th nerve. Now, if you say that between pyramid, which is on the anterior side of the medulla oblongata, and olive, which is slightly posterior, sandwich between the two is the 12th nerve, then what is behind the olive? It is the number 9, 10, and 11, passing behind the olive. Actually, you should know the sequence. Which is the most anterior structure in the medulla? The pyramid. What is after that? The 12th nerve. What is after that? That is the olive. And what is after that? The number 9, 10, and 11 behind the olive. Now, once you have that kind of orientation, I see one more nerve coming here from the spinal cord. Who is that? This nerve which is coming from spinal cord is called as the spinal accessory nerve, spinal part of accessory nerve. Now, if you say this is the spinal cord and giving you spinal accessory nerve, where is it coming from? C1 to C5. C1 to C5. So, C1 to C5, you will have this spinal accessory nerve. Yes. What is it doing? It will enter the foramen magnum and join the cranial part. You mean to say cranial part of the 11th nerve. Yes. So this is the cranial part of 11th nerve. Yes. Now this is the cranial part of 11th nerve and the spinal part of 11th nerve, and together they will run. Yes. This spinal accessory, that is cranial accessory. And who is this? This is all now number 9, 10, 11. Actually, now number 9, 10, 11, the cranial part of 11, they would have come from the nucleus ambiguous, and nucleus ambiguous is present in the medulla oblongata to control the muscles of palate, pharynx, larynx, and they are for the speech and swallowing, if you remember. So you're telling that the number 9, 10 and cranial part of 11? Yes. The number 9, 10 and cranial part of 11, they will come from the nucleus ambiguous in the medulla oblongata and control the muscles of palate, pharynx, larynx for speech and swallowing. Is coming behind which structure? That is the olive. This is the olive. This is olive, then who is this? This is the pyramid. If that is the pyramid and that is the olive, then who is this? That is the axons of the 12th nerve, sandwich between pyramid anterior, olive posterior. So who is the most anterior? The pyramid. What is behind that? The 12th nerve. What is behind that? The olive. What is still behind that? The nucleus ambiguous sending the number 9, 10, 11. Which part of 11? Cranial accessory nerve, because spinal come from spinal cord. So these are some of the orientation which you needed to have. Once you have all that information with you, let's proceed further and quickly revise it. As you're revising the details of brainstem, you will not have any problems now, because you already have discussed now number 3 and the number 4 come from the midbrain. So that is the number 3. And that is the number 4 coming from midbrain. Where is the number 5 coming from? The number 5 is trigeminal coming from the pons. And where is the number 6, 7, 8 coming from? Maybe the number 6, 7 or maybe the number 8. They would have come from pontomedullary junction. This is the number 6. This is the number 7. This is the number 8, pontomedullary junction. And where is the number 9, 10, 11 coming from? 9, 10 and actually cranial part of 11 would have come from nucleus ambiguous behind this structure which is called as olive. So this is the number 9, 10, 11 behind olive. What is sandwich between the pyramid anterior and olive posterior? That is the 12th nerve, and that is the hypoglossal nerve. Actually here, this is hypoglossal nerve. This red color is hypoglossal nerve. And then you have the spinal accessory nerve coming from the spinal cord. We already have discussed, this is just a schematic diagram of that. Now, once you have that kind of orientation for the brainstem, we actually have to start with further details, and which are, see, this is the optic nerve we have seen already. That is the oculomotor nerve. This is the trochlear nerve, the thinnest nerve. Trigeminal is here. The abducent, the facial and glossal, the vestibulocochlear. Then you have number 9, 10, 11 and number 12 also. This is front view of the brainstem, actual brain. So that is the number 2, this is the number 3, this is the number 4, this is the number 5, this is number 6, 7, 8, and then 9, 10, 11, and 12, just to have some orientation in the actual brain. This is the pyramid, which is more anterior, that is the olive, which is more posterior. They are present on the front side of the medulla oblongata. This is the pons. And here you have the crus cerebri of the midbrain, crus cerebri of the midbrain. Now, once you have that orientation in the real brain also, dissected specimen, there's a question asking, nucleus tractus solitarius. You remember, Schwann-Entius, a mnemonic? You remember the mnemonic Schwann-Entius? You remember what is T for? So it is a taste which will be reaching the tip of the nucleus tractus solitarius. And when you say taste is reaching the tip of the nucleus tractus solitarius, it is SVA. What is SVA? What is S for? S for special. And what is V for? Visceral. And what is A for? Sensation. So special visceral sensation of the taste is received by the tip of the nucleus tractus solitarius. Yes. I think the nerves involved for taste are FGV. Yes, FGV. F for facial, yes. G for glossopharyngeal, yes. V for vagus, yes. You mean to say the answer is choice number D? Yeah, because it's a pure motor nerve to control muscles, and it has nothing to do with the sensory nucleus, which is called as nucleus tractus solitarius. So nucleus tractus solitarius is actually a sensory nucleus. It has nothing to do with a motor nerve. It's a pure motor nerve, accessory 11th nerve. So that is the answer. Yes, that is the answer, because FGV nerve, they will bring the taste sensation to the tip of nucleus tractus solitarius. The neural column is SVA. Who is the other SVA? One is taste. Who is the other SVA? The smell. But remember, smell will never come to brainstem. Smell do not come to brainstem. Smell is telencephalon. It doesn't come to brainstem. Brainstem comes only the taste. This is a discussion on brainstem nuclei, actually. So you keep your answer accessory. Yes, accessory should be the answer. Now we are looking at the brainstem and their nuclei. And which nuclei? Of course, the number 3 to 12 nuclei. Let's do that. This is a diagram of the brainstem, and it has 3 components, which you already know. There will be a midbrain, and then there's a pons, and there is the medulla oblongata. And we want to talk about some of the nuclei inside. Then we draw a diagram also. You see, the number 3 to 12 cranial nerve nuclei are found in the brainstem. That's what we want to discuss. The number 3 and 4 nuclei are in the midbrain. Now, number 3 nucleus is at the level of superior colliculus, and number 4 nucleus is at the level of inferior colliculus. And coming from midbrain, yes. What about the number 5, 6, 7, 8? 5, 6, 7, 8 nuclei are in the pons. 5, 6, 7, 8 nuclei in the pons, but it is not necessarily restricted to pons, because some of the neurons may extend upward and downward into midbrain and medulla. They are not restricted to pons, though chiefly the neuron bodies are in pons. The number 5, 6, 7, 8. And what is there in the medulla oblongata? It is the number 9, 10, 11, 12. The number 9, 10, 11, 12. If you remember, we have discussed the nucleus ambiguous is the number 9, 10, 11. Which part of 11? Cranial 11. It is in the medulla oblongata. So you're telling nucleus ambiguous is the number 9, 10, 11, cranial part of 11, and it is in the medulla oblongata? Yes, it is there. So the number 9, 10, 11 are in the medulla oblongata. That's what? Yes. Now, once you have that information, remember the number 5, 6, 7 we have told are in the pons, but not necessarily. There can be overlapping neurons. Some neurons can go up and some neurons can go down also, like you will see now some details. Trigeminal nerve nuclei are overlapping. There is one main sensory nucleus of trigeminal in the pons, but there is a mesencephalic sensory nucleus of trigeminal going to midbrain, hence the name mesencephalic. And one of the nucleus is coming to the spinal cord, hence the name spinal sensory nucleus of trigeminal. So this is the 3 sensory nuclei of trigeminal. Yes, there is main sensory in the pons and one going to midbrain, hence called mesencephalic sensory nucleus of trigeminal, and one is going into the spinal cord, hence called spinal sensory nucleus of trigeminal. We'll draw a diagram for the same, but at this moment tell the nuclei which you find in the medulla oblongata. Some of them are near the midline, some are away from the midline. So when you say so, you will find nucleus ambiguous is lateral medulla, the spinal nucleus trigeminal is lateral medulla, and the solitary nucleus is lateral medulla. But why do you want to know the nuclei in the lateral medulla? Because they will be compromised in lateral medullary syndrome, which is called Wallenberg syndrome. So when you talk about Wallenberg syndrome due to lateral medullary ischemia, the nuclei involved will be nucleus ambiguous and spinal sensory nucleus of trigeminal and nucleus tractus solitarius. So nucleus tractus solitarius and spinal sensory nucleus of trigeminal and also the nucleus ambiguous. Then which nucleus is not involved in Wallenberg syndrome? The nucleus which is near the midline. Who is that? The 12th nucleus. If you remember, we have discussed 12th nucleus is near the midline, so it will be affected in which syndrome? Medial medullary syndrome, leading to muscle paralysis, tongue muscle paralysis. So hypoglossal nucleus is near the midline and it will be affected in medial medullary syndrome and tongue muscle palsy. It is not affected in lateral medullary syndrome. Now, once you have that orientation, we are going to draw these nuclei ourselves. Let us do that. This is the midline of the body, and we want to discuss Wallenberg syndrome, medial medullary syndrome then. And this is the front view of the brainstem. If you say this is the front view of the brainstem, tell the three components of brainstem. The three components of brainstem are midbrain, followed by the pons, followed by the medulla oblongata. So you are telling that this is the midline of the body, and we are looking at the front view of the brainstem, which is midbrain followed by pons, followed by medulla oblongata. Yes, and then you can tell this is the third nerve nucleus giving third oculomotor nerve. This is fourth nerve nucleus giving the fourth trochlear nerve. As you understand, the third nerve nucleus is at the level of superior colliculus midbrain, and the fourth nerve nucleus is at the level of inferior colliculus in the midbrain. So understand that the number 3, 4 will come from the midbrain, and the third nucleus is at the level of superior colliculus, and the fourth nucleus is at the level of inferior colliculus. This is the number 3, 4 coming from the midbrain. Then where is the number 5, 6, 7, 8 nuclei? If you say number 5, 6, 7, 8 nuclei, 5, 6, 7, 8 nuclei, then they are present in the pons, but not necessarily restricted to pons, as there can be overlapping neuron bodies. Though nuclei 5, 6, 7, 8 are mostly neuron bodies are in the pons, but they may be going up and down into midbrain or into the medulla oblongata. We'll discuss some of them, like you can tell trigeminal we have discussed. But at this moment, just tell where is the nucleus of nerve number 9, 10, 11, 12 present. Nuclei of nerve number 9, 10, 11, 12 are present in the medulla oblongata, of course. Now, medulla oblongata is having nuclei of nerve number 9, 10, 11, 12, fine. But are they restricted to medulla? No. Neuron bodies can go up and down also. We will see that detail after some time, but here just mention about 8th nerve. What about 8th nerve? If you remember, 8th nerve is at pontomedullary junction. So when you say 8th nerve nuclei are at the pontomedullary junction, that means the 8th nerve neuron bodies are not only restricted to pons but also extend into medulla. That is why you remember vestibular area. The vestibular area, which is in the lateral medulla, if it is lesion giving you vertigo, is a feature of Wallenberg syndrome. What happens in Wallenberg syndrome? In Wallenberg syndrome, there is some lateral medullary ischemia, and because of that lateral medullary ischemia, there will be vertigo. See, this is 8th nerve at the pontomedullary junction, and some of the neuron bodies extend into lateral medulla. So, in the lateral medulla, there was some ischemia leading to injury of the vestibular area and vertigo. Vertigo is a feature of lateral medullary ischemia and Wallenberg syndrome. What are the other clinical features of Wallenberg syndrome then? That we will discuss. But before that, talk about some overlapping nuclei for trigeminal. If you say trigeminal has overlapping nuclei, you will see trigeminal nerve has 1 motor and 3 sensory nucleus. 1 motor and 3 sensory nuclei. Now, once you say trigeminal nerve is having 1 motor and 3 sensory nuclei, talk about them. See, the motor nucleus of trigeminal is here. And what is it doing? It is controlling the muscles of mastication, which develop in first pharyngeal arch. So you're telling that trigeminal nerve has 1 motor nucleus, which is in the pons. Yes, in the pons. And is controlling muscles of first pharyngeal arch, that is the muscles of mastication. Yes. And the nucleus is in the pons. Yes. Then, what about the 3 sensory nuclei of trigeminal? When you say 3 sensory nuclei of trigeminal, you will see the 3 sensory nuclei of trigeminal. You will find they were having some names, like this is the main sensory, mesencephalic sensory, and then spinal sensory nucleus of trigeminal. So you are telling that there is some main sensory nucleus of trigeminal in the pons? Yes, in the pons. Now, when you say there is a main sensory nucleus of trigeminal in the pons, then what is this nucleus going to enter the midbrain? The one which enters the midbrain is called as mesencephalic sensory nucleus of trigeminal. So this is the one, yes. Because it is extending into midbrain, you are calling it as mesencephalic sensory nucleus of trigeminal. And what about the one which is going to enter the spinal cord? The one which is going to enter the spinal cord is passing lateral medulla. And after passing lateral medulla oblongata, it is entering the spinal cord, hence called as spinal sensory nucleus of trigeminal. Now, if that is a spinal sensory nucleus of trigeminal, it is passing the lateral medulla. What is it doing? What is the function? Actually, what it will receive is pain and temperature of the same side of the face. You mean to say is pain temperature of the same side of the face will go to the same sided nucleus? Yes, actually pain and temperature from the same side of the face, ipsilateral. Yes, ipsilateral. Ipsilateral sensation going to spinal sensory nucleus of trigeminal, they'll reach here. Then what is the mesencephalic sensory nucleus for? Mesencephalic sensory nucleus of trigeminal is for receiving proprioception. What is proprioception? Proprioception means the position sense. Position sense of what? Position sense of what? Anything which is moving in the head region. What is moving in the head region? Eyeball and the tongue and the mandible. So, can you see your own eyeball or tongue mandible? Can you see your own eyeball, tongue mandible? You cannot until you have a mirror. If you have a mirror, then you can see. Otherwise, you cannot see your own eyeball, tongue or mandible. Then how do you know the position of these structures? That eyeball going up, down, right, left, tongue going up, down, mandible going open, close the mouth. How do you know? Because the position sense is received by this nucleus. Mesencephalic sensory nucleus of trigeminal will tell you the position of eyeball going up, down, the mandible opening, closing the mouth, or the tongue going right and left. This nucleus will tell you the position sense. Then what is this nucleus for? Whatever left on the face. What is left on the face? See, except the pain temperature and proprioception, whatever. So except the proprioception and pain temperature, whatever will come here. Like what? Touch the cornea. This nucleus is activated. It will receive touch sensation. So touch sensation, touching the cornea, this main sensory nucleus is activated. Yes. So touching the cornea and this main sensory nucleus is activated. Put a tuning fork to the mastoid process, vibration. When you put a tuning fork to the mastoid process here, vibration is also received here. So touch and vibration. Yes, touch and vibration, many more sensations. So touch and vibration sensation come to the main sensory nucleus of trigeminal because pain temperature received by spinal sensory nucleus of trigeminal. Yes, and the position sense received by mesencephalic nucleus of trigeminal. Now, once you have that kind of orientation, let's proceed further. And what we want to talk about is more nuclei in the medulla oblongata. You see, this is now number 9, 10, 11, making nucleus ambiguous. Now, if you say now number 9, 10, 11 are making nucleus ambiguous, can I see the nucleus ambiguous in the medulla oblongata then? Yes, of course, why not? This is the nucleus ambiguous. Now, number 9, 10, 11. Which part of 11? Cranial part of 11. So, this is now number 9, 10, 11, cranial part of 11, making the nucleus ambiguous. Where is it present? In the medulla. Which medulla? The lateral medulla. Now, if the nucleus ambiguous is present in lateral medulla, what is it doing there? What it is doing is controlling the pharyngeal arch muscles developing in the arch number 3, 4, 5, 6. And what are they? They are the muscles of the palate, pharynx and larynx, if you remember. So you're telling that this is the number 9, 10, 11, cranial part of 11 in the lateral medulla, nucleus ambiguous, controlling the pharyngeal arch muscles of arch number 3, 4, 6, which are muscles of palate, pharynx, larynx for speech and swallowing. Yes, speech and swallowing. Now, in the medulla oblongata, you have one more nucleus. It is called nucleus tractus solitarius, and the tip will receive the taste sensation, if you remember that. So, this is nucleus tractus solitarius. It is also in the lateral medulla. Yes, it is in the lateral medulla, and the tip will receive the taste sensation. We'll bring the taste to the tip of the nucleus tractus solitarius, the FGV nerve. If you remember, you had a mnemonic. Your mnemonic is sweat and tears. What is sweat and tears? What is S for special? What is V for visceral? What is A for sensation? So special visceral sensation of what? The taste going to the tip of nucleus tractus solitarius here. And which nerves will bring the taste sensation there? The FGV nerve, facial, glossopharyngeal and vagus nerve. And it is in the lateral medulla. Now, once you say it is in the lateral medulla, fine. What about the 12th nucleus? Where is the 12th nucleus? It is, already near the midline. Let us show it near the midline. And when you show the 12th nucleus near the midline, you will tell 12th nucleus, which is near the midline, is compromised in the medial medullary syndrome, not in the lateral medullary syndrome. Because 12th nucleus is near the midline, it will be compromised in medial medullary syndrome, not the lateral medullary syndrome. What will be compromised in lateral medullary syndrome? These 3 nuclei plus one more, the vestibular. Already you have discussed the vertigo. Can you tell me the 4 clinical features of lateral medullary ischemia, Wallenberg syndrome now? Wallenberg syndrome, which is lateral medullary ischemia, clinical feature number 1, vertigo. Why vertigo? Due to injury of the lateral medullary ischemia, there is injury of the vestibular nucleus. What is the clinical feature number 2? It is ipsilateral loss of pain temperature on the face. Why in Wallenberg syndrome you have ipsilateral loss of pain temperature on the face? Because of injury to the lateral medullary ischemia and the spinal sensory nucleus of trigeminal. And what about the clinical feature number 3? That is loss of taste sensation from the same side of tongue. Why there is loss of taste sensation from the same side of tongue? Due to injury of nucleus tractus solitarius. So there is injury of nucleus tractus solitarius, and then there is some ipsilateral loss of taste sensation. Means if you put the sensation on the same side of the tongue, then there will be no loss of taste sensation. Actually, you cannot feel the taste. That is the point. Due to injury of nucleus tractus solitarius. What is the clinical feature number 4? That is here, difficulty speech swallowing. Difficulty speech swallowing. But why there is difficulty speech swallowing? Because paralysis of the palate, pharynx and larynx muscle. Why they are paralyzed? Because injury of nucleus ambiguus. So it is lateral medullary ischemia and compromising the nucleus ambiguus and paralyzing the muscles of palate, pharynx, larynx on the same side, leading to difficulty speech and swelling. So Wallenberg syndrome, which is lateral medullary ischemia, what are the 4 clinical features? Number 1, it is vertigo. Number 2, it is the loss of pain temperature on the face on the same side. Number 3, it is the loss of taste sensation on the same side of tongue. Number 4, it is the difficulty speech and swallowing. But will there be any problem with the 12th nucleus? No, because 12th nucleus is near the midline. It will be affected in medial medullary syndrome. We'll discuss Wallenberg syndrome later also. At this moment, just proceed further. And you have drawn this diagram basically. Now, we want to look at the details of trigeminal nuclei. It will be kind of a revision. Let's do the revision of trigeminal nerve nuclei. 4 nuclei, 1 is motor and 3 are sensory. That's what we want to discuss. You see here, this is the trigeminal nerve having 4 nuclei. So out of 4 nuclei, we are having 1 motor nucleus in the pons, which will control the muscles of mastication developing in the first pharyngeal arch, and then you have 3 sensory nuclei. When you're talking about the 3 sensory nuclei, you will observe that there is 1 going into the midbrain. The one which goes into midbrain is called as the mesencephalic sensory nucleus of trigeminal to receive position sense of the eyeball or the tongue or the mandible. And if you're talking about the one which is going to enter the spinal cord, that is the spinal sensory nucleus of trigeminal, which will carry pain temperature of the face of the same side, and rest of the sensation should come to the main sensory. Maybe it is the touch sensation on the face, or maybe it is the cornea, maybe it is the tuning fork on the mastoid process, vibration, sensation will come here. main sensory nucleus of trigeminal. Now, let us check the reflexes of the trigeminal, masseter reflex. How do you do masseter reflex, the jaw jerk? Take a knee hammer and hit the mentum. Open the mouth. So you will take a knee hammer and hit the mentum directly. Now put a finger here and hit the finger. Your finger you have to hit and open the mouth. Suddenly open the mouth. What will happen? Suddenly it will close. It's a reflex. So let us discuss the detail. You are taking a knee hammer and suddenly opening the mouth by moving the mandible down. But as the mandible is changing the position, it is proprioception. And that proprioception will be carried by the mandibular nerve branch of trigeminal nerve. Now this is the mandibular nerve branch of trigeminal nerve. Yes, it will carry the proprioception, change of position of the mandible that it has opened the mouth. And what is the change of position received by a nucleus, which is mesencephalic sensory nucleus of trigeminal? It will receive the proprioception. Then it will ask the motor nucleus of the trigeminal, wake up, wake up. Move the muscles of mastication. So you are telling that it will now activate the motor nucleus of trigeminal, which will then activate the muscles of mastication. Yes, which nerve is that? Again, the mandibular nerve branch of trigeminal. So mandibular nerve branch of trigeminal is also carrying the motor fibers along with sensory fibers. Yes, we will discuss that as well. But the muscle masseter is activated. As the masseter is activated, it is an elevator of mandible and the mouth will close. Masseter is an elevator of mandible and mouth will close. See, what happened was you have suddenly opened the mouth and suddenly it will close. Can I control this? No, you cannot control reflexes. It is a reflex. So mouth opens and closes suddenly. Yes, it's a masseter reflex jaw jerk. Which nerve involved? We have already told. It is the mandibular nerve branch of trigeminal. It is not only motor but also sensory in nature. This is jaw jerk or masseter reflex. Now we are moving further to talk about nucleus tractus solitarius. Actually, it is a revision only. We have discussed some details, so we'll add on to that. Actually, when you are talking about the anterior 2/3 of the tongue, the taste sensation is carried by cauda tympani nerve, branch of the facial nerve, towards the tip of the nucleus tractus solitarius. You know FGV nerve? This is F. So we are telling that taste sensation from anterior 2/3 of tongue is carried by F, the facial nerve, cauda tympani nerve, branch of facial nerve, to the tip of the nucleus tractus solitarius. Yes. What about the posterior 1/3 of tongue? Posterior 1/3 of tongue, then you have the glossopharyngeal nerve. And what about the posterior most tongue? Not only posterior most tongue, but also the epiglottis. It's a vagus nerve. FGV, the vagus nerve. So you are telling that the epiglottis or the posterior most of the tongue, the taste sensation is carried by vagus nerve towards the tip of the nucleus tractus solitarius. What is for the bottom? Bottom. What about the bottom? If you want to know about the bottom of the nucleus tractus solitarius, then it is different tract because taste is SVA. Then what will come to the bottom? Do you remember? If taste is SVA to the tip, what is to the bottom? For that, if you remember, we have discussed GVA. What is G for? General. What is V for? Visceral. What is A for? Sensation. General visceral sensation of what? Chemoreception. And the vasopression. What is vasopressor? What are you talking about? Carotid, body carotid, sinus? Yes. See here, magnified view. There is a carotid sinus, baroreceptor, blood pressure, and there is a carotid body also, which is for chemoreception. At the bifurcation of common carotid artery. So at the bifurcation of common carotid artery, we have carotid sinus for blood pressure and carotid body for chemoreception, activating what? It is the information carried by 9th nerve, glossopharyngeal, towards the bottom of nucleus tractus solitarius, towards the bottom, the lower part. And what the nucleus tractus solitarius will do? It will integrate the information and accordingly activate the vagus nerve, the 10th nerve. So 10th nerve, vagus nerve is activated now. The outgoing fiber. Yeah, actually this is the incoming fiber to the CNS, this is outgoing fiber to the CNS, and then you can accordingly work upon the heart. Like you can cause bradycardia. Why I am causing bradycardia? Maybe there was some change in the blood pressure. There was a high blood pressure. So there was high blood pressure detected by some baroreceptor, the carotid sinus pressure, yes, carried by ninth nerve towards the bottom of the nucleus tractus solitarius, which will then tell the vagus nerve go and cause cardio inhibition. As there's a cardio inhibition, then there will be, of course, fall in the blood pressure. Okay, if you say so. This is GVA. Yes, that is GVA, general visceral sensation coming to the nucleus tractus solitarius. That is GVA.